Welcome back. Now, as the COVID-19 vaccine finally jets into the country, the government will be seeking to start administering it as soon as is practically possible. The state has announced plans to build capacity for the rollout phase. That's what we want to take a look at on Fact Finder tonight. Now, the World Health Organization's Vaccine Readiness Assessment Tool has recorded Kenya's average score at 33% preparedness for the COVID-19 vaccine rollout. And that's against the recommended rollout readiness rate of 80%. That's what we want to get into, and joining us in studio is Professor Julius Oyugi, Professor of Virology at the Department of Microbiology at the University of Nairobi. Thank you, Prof, for joining us. Now, explain it to us in lay terms, 33% preparedness according to that WHO tool versus the required 80%. What would this mean?
Thank you, Ben. That's a great question as far as COVID-19 vaccination is concerned in Kenya. Normally, WHO has a scorecard where they have a number of things they're looking at for them to show your level of preparedness. For our viewers to understand some of these requirements, number one, they look at the vaccine itself. What is the requirement for transportation of this vaccine before it is given to human beings? AstraZeneca vaccine requires to be transported at fridge temperature. So the first thing they want to look at is, do you have infrastructure on the ground that would ensure that this vaccine is maintained at fridge temperature until it is given to the person? That's number one. Number two, amongst the things that they're looking at is the training for the healthcare workers who are going to administer this vaccine. And this training, the number of components. One is the administration of the vaccine itself.
All right.
Number two is collecting data on the side effect of the vaccine. And this is important so that, as the vaccine is being rolled out, this information is captured. All right. Then the third thing that is also important is the education to the public about the safety and the efficacy of the vaccine. This needs to be rolled out before the vaccination is carried out.
So with all this information, how much work do we have to do, or does the government need to do?
The only thing that we have in place is the infrastructure for transportation of the vaccine. For example, we have been using similar vaccines before, like the polio vaccine, which has to be transported through around the same temperature. That one infrastructure is in place. But I think we have not done well in terms of training. I heard the CS Health today talking about them starting to train the healthcare workers now, and the vaccine is already here. I didn't hear them talking about educating the public, including the healthcare workers, on the safety and the efficacy of the vaccine. So we really need to do a lot around those two areas.
Thank you, Prof, for that information. Professor Julius Oyugi, Professor of Virology at the Department of Microbiology at the University of Nairobi.